Thank you very much, Millie, and good morning, everybody. I too would like to pay my respects to elders past, present, and emerging. Look, I think it's fair to say that it has been a challenging year as we've learnt to balance COVID-19 and emerge as business as usual from the pandemic. We're really proud of our achievements, and I would like to acknowledge the contribution made by so many people, our staff, our communities, our councils, right across our region who contributed to keeping our community safe over the last 12 months. Our heartfelt thanks to each and every one of you. I'm going to start with just a few figures to set the scene for the year about the work that the Murrumbidgee Local Health District has undertaken. So let's start with our emergency departments, where we saw activity really move and come back to normal. In fact, we did even more activity in the last 12 months. It was up 3% on the last year, with almost 150,000 people presenting for care. Also, in our admitted activity in our hospitals, we saw 67,332 people admitted into our facilities, which was just slightly below the previous year, where of course we had a lot of impact from COVID-19. I think it's fair to say that the activities probably gone back to normal. For our admitted care for mental health, we've seen an increase of admitted patients, which is up 4.7%. So we've had 2,850 people admitted for mental health care and support. Surgery, as you will know, was deferred on and off during the 12 months, but the district managed to continue to provide surgery for a majority of the time, with 17,532 surgical cases performed during the year. Also, we perform a lot of care outside of the walls of our hospitals, and over 1 million occasions of service were provided to people in community settings or in their homes, with 1,147,000 people who received care. And babies, everybody is interested to know what's happened with births. So 2,188 babies born over the year, which is actually only up about 10 to 15 births from last year, so slightly increased. I think it's important to recognise that 341 people live in our residential aged care facilities, which they call home. I'm going to touch now on some of the key achievements over the last 12 months, and then I'll talk about our workforce. So let me start with public health. It's been a big year for our public health unit and for our public health response in response to the pandemic. We have received and provided health care to thousands of people over the last 12 months. And not only have we provided care for people in hospitals, but we've also provided a lot of new models of care to people. And COVID-19 helped us to do that, providing acute care for people in their homes and really providing more holistic care, and going into a process where we co-design care with our consumers so that we understand where the pain points are and where the gaps are. But in public health, I want to thank our COVID doctors and all of the nurses who continue to care for people with COVID-19, both in the community, in their homes, for the provision of antiviral drugs with the GPs, who played a really big part in the response of vaccination also during the year. Also, our public health unit had to adapt and pivot to another new virus that appeared in our region over the last 12 months, the Japanese encephalitis virus, with our region recording 8 of the 13 cases as it first came into New South Wales. Our public health unit undertook case interviews, clinician alerts, and collaborated with local industries and councils to quickly establish processes, alerts, and now we've moved towards vaccination for eligible LGAs and people. The public messaging around reducing exposure to mosquito bites is absolutely critical for each and every one of us, particularly now this year if we've moved into flooding and we've got a lot of low-lying water around. In the new models of care, we have done some very, very interesting work with the Murrumbidgee Primary Health Network, where we understand that we need to take a one system approach to caring for people with chronic disease. The care pathway that we've developed with the Primary Health Network and general practice and our specialists has identified areas that we know are gaps in access to care, and we're very proud to advise that we've received some additional seed funding to help us improve access to care for people with chronic disease and to help them manage their disease and keep them out of hospital and out of our emergency departments. We've also been really busy with our shovels and spades and our bricks and mortar. So our infrastructure programs all continued over the last 12 months without any impact from the pandemic, which is really pleasing. One super big project that's underway at the moment, obviously, is a redevelopment of the Griffith-based hospital, a $250 million project, which everybody is really excited about. So over the last year, lots of enabling works were completed, which finalised that stage of the development. So we now started on that great big new clinical services building. But we saw the completion of a non-clinical services block, which provides food, kitchens and all of those support services. Back of house services was completed and will continue to support the new hospital. Also the relocation of the paediatric ward and the demolition of all those old buildings at the back of the hospital to pave the way for the beautiful new building, which is now underway. Also the $50 million Tumut Hospital project was completed. An absolutely exquisite facility, co-designed with community, and is very much a centre of excellence. And the community told us they wanted a community hub. They wanted a place that focused on wellness, that was welcoming and focused on well-being. And the results are absolutely magnificent. And it was wonderful to see the landscaping and culturally appropriate places for people to enhance their well-being. We also had the opening of the Murrumburra Harden facility, which is now progressing towards becoming an MPS, a beautiful facility again that provides really fantastic aged care as well as emergency apartment services. And within that hospital, a special project in collaboration with Art Galleries New South Wales, where we're using art as part of healing and as part of well-being. So much evidence to show how people feel good and how it impacts on our brain when we use culture as part of our well-being strategies. Also the Wagga redevelopment, the car parking project has transitioned and progressed with the opening of 2 on-grade car parks and now of course a multi-deck car park which is due for completion in the coming months. Some also really important work at Deniliquin Hospital, where we saw the upgrading of the emergency department and some very happy doctors, nurses and clinicians there welcoming patients into a really contemporary environment to be able to provide that emergency care for adults and for children. Also, work commenced at Leeton Hospital for their emergency department upgrade, which is continuing this year. Service planning was also a critical part of the year. We worked with communities across our district, particularly Coolum, Finley and Temora, where we completed our service plans, which really are a map for the services that are needed by the community into the future. I'm just going to talk now a little bit about locally led reform and 3 things in particular that I just wanted to acknowledge. The first one, Dr. Kate Fitzgerald, who is an absolutely fantastic surgeon from the Griffith-based hospital, who pioneered the introduction of mag seed into the hospital for women with breast cancer. I had the opportunity to visit and meet with the support group, the breast cancer support group, and Dr. Kate recently with this pioneering surgery with a tiny seed implanted to help the surgeons quickly find the tumour during surgery and reducing the length of stay in hospital for people, a number of interventions that they need. Also a research highlight, and it's wonderful to see more research capability growing across our region. Dr. John Preddy, a shining light in advancing research in our region, received close to $3 million from the Commonwealth Medical Research Fund, Futures Fund for strengthening care for rural children. and has also pioneered work in the establishment of the first community paediatrician. A different model where we've got a community paediatrician embedded with GPs and enhancing the skills in local communities to be able to care for children closer to home. Some also exciting work with the Murrumbidgee Health and Knowledge Precinct, where we received $1 million to commence our planning. An interim board has been established. But this is an excellence hub, and it's very much focused on research and innovation, integration of services, and education and training, growing our own. And that just leads me very nicely into workforce at its best. Everybody knows it's been an extraordinarily challenging year for regional workforce across all industries, and health is no exception. We have had record numbers of vacancies, and we established a critical vacancy task force to take the work away from the local managers and support them in getting staff onto the ground as quickly as we possibly can. The innovative work has really reduced the number of vacancies we have, particularly with nursing across our region, but we know we have to do so much more. Growing our own has been the most successful strategy that we have had in many years, and we've done two key things this year. The first one is to significantly increase the number of new graduate nurses into our region, but we know they need a lot of extra support, so we have been successful in recruiting additional nurse educators, roving around the region, as well as the nurse educators who are at each facility, to be able to provide support in hours and after hours for our new graduate nurses. We've also just launched something this year which will provide additional support to those early career nurses by the way of a virtual nurse assist, where 24-hour support will always be available for those early career nurses. We need to nurture them, grow their skills, and really look after them and encourage them to stay in our regional community. We've provided support with travel and accommodation, as we know that's also very challenging in our regional areas. They are having a wonderful time. Many of them have come from Sydney and other cities and are really enjoying their life here in our region. And finally, the Murrumbidgee Rural Generalist Training Pathway. For many years, we kept hearing about the reducing numbers of GPs, and we experienced difficulties with GPs trained not having necessarily got the skills or experience to work in an emergency department of a rural hospital or look after patients in a rural hospital. So training our own now employed GPs who are being trained, not only in general practice, which is critical in the community, but also training them with advanced skills to be able to work in a hospital, whether that's in surgery, whether that's in maternity, anaesthetics, or the emergency department, palliative care. There are a range of options that people can choose. Very, very successful model in partnership with the Australian government, and is now being scaled further across other states and across New South Wales. I thank all of our GP trainees who have been such an important part of this critical pilot, and acknowledge Dr. Paul Mara, who came to us with an idea that was best to nothing. Okay, finally, I just want to acknowledge the work that we are doing with Aboriginal communities across our region. It's very, very important that we acknowledge that we have to do more than talk about making our services safe and culturally safe for Aboriginal and Torres Strait Islander people. It starts with embedding more Aboriginal Torres Strait Islander clinicians and executives within our workforce, and we have significantly increased the number of Aboriginal people working in our region, with nurse cadets, some junior medical officers, and some executive as well. We know that that is part of what we need to do. We need to also change our behaviour, and we've all undertaken our self-assessment for cultural safety, which really lays out the pathway that we need to take in taking action to reduce racism and to make sure that we understand how we can talk with Aboriginal people and recognise the difference in a culturally appropriate way. We've rolled out something called clinical yarning. Sometimes when we talk to our patients, and I'm sure all patients sometimes feel that we're talking in gobbledygook with people, The clinical yarning is actually using Aboriginal culturally appropriate language around establishing trust, establishing a connection, and then talking about what needs to happen and giving that options back to the Aboriginal person so that they can be a partner in their care. So the aim is for all Murrumbidgee clinicians to be trained in clinical yarning so that we can really develop that trust and safety in the services that we provide. I'm also very proud to be part of the Riverina Māori Regional Alliance and the negotiations that we have now completed this year in our local decision-making accord. The accord and the MOU were signed in the previous year, but we've had some fantastic conversations about strengthening family, improving health and wellness and holistic care, and really helping to look after our children in the Aboriginal communities. We've completed the schedules, and I believe, as sitting around the table with the delegates from RIMRA, that I have a much deeper understanding into the work that needs to be done across government by all government clusters, and that we need to not only work in our own silo, but work with all government agencies. Finally, just to finish up, I'd really like to again acknowledge the staff for their continuing compassion, extraordinarily unwavering commitment to your communities and to caring for people in your region. I'd like to extend my thanks to the Murrumbidgee Board for their guidance, their stability and their expertise. We are very fortunate to have a board that adds enormous value to this organisation. The advice and the skills they bring to the table guides us in the right direction. And I'd like to acknowledge Dr. Tom Douch, the board chair, for his extraordinary support to me over the last 12 months. And sadly, Dr. Douch has finished his tenure with the board and will be finishing up at the end of this year. So Dr. Tom, thank you very much for everything you've done for the Murrumbidgee Local Health District. So to our volunteers, our LHACs, our United Hospital Auxiliaries, our staff, I thank you from the bottom of my heart for all you have done. Thank you.